Hi, everyone, and welcome to the Raymond Report. I'm Eric Raymond, and I'm here to cut through the confusion and help you out with your personal health insurance problems. Remember this great scene from the movie Network?
I want you to get up right now and go to the window, open it, and stick your head out and yell, "I'm as mad as hell, and I'm not going to take this anymore!" I'm mad as hell! I'm not going to take it anymore! I'm not going to take it anymore!
You know, when it comes to health insurance, every one of us should be shouting out our windows, "I'm mad as hell, and I'm not going to take it anymore." We live in the greatest country on the planet, and our health insurance system is a worldwide disgrace. It's too expensive, it doesn't make sense, and talk about a disgrace, just look at these numbers. 47 million of us don't have health insurance. Listen to what the people on the street have to say about it.
I think that's really sad. It is, because, I mean, there's a lot of people out here that would like to go to the doctor and can't afford to go. But what do we do?
That is shocking. And I can tell you that every single one of the 2,500 people who work for me have health insurance. I can also tell you that we could never begin to fully cover their families without a contribution from them. We never could do it. We would be bankrupt.
It's so expensive. Even if you want health insurance, you can't afford it. The hospitals are providing too much free care one way and then overcharging everywhere else the other way.
So here we are on the eve of our presidential election, with health insurance one of the hottest issues. And the American Cancer Society launches an unprecedented campaign warning that the drop-off in cancer rates is leveling off because people without insurance don't get the early detection needed for the latest cures. And maybe you've seen this series of public service announcements sponsored by AARP.
This is a message for political candidates. Don't tell us you'll improve health care, just so people will vote for you.
I'm too young to vote.
But if I could vote, I'll vote for a candidate who'll fix health care.
Yes, we have to fix health care for the next generation. But meanwhile, you have problems that need solving right now. September's Consumer Reports points out just how expensive health care is even for those people with insurance. In fact, 29% of you who responded to that survey said that even with insurance, your plan paid so little you had to actually postpone your treatment because you couldn't afford it. And 59% of you say you went into debt to pay your medical bills. And guess what the #1 cause of bankruptcy is in the United States? No, it's not subprime mortgages. It's people who cannot pay their medical bills. So let's get down to some solid advice for those of you that don't have medical insurance and for those of you that do as well. And let's take care of the most important members of our family, our kids. Let's make sure they're covered. So here's my first tip of the day. Check out your state CHIP program, the Children's Health Insurance Program. It's federally and state funded and designed specifically for those of you who earn too much to qualify for Medicaid but can't afford to buy private insurance for your kids. The CHIP program can provide your child with everything from regular checkups to x-rays and prescription drugs. Much needed help when you need it the most. For information on the CHIP program in your state, go to theraymondreport.com and we'll link you right to your program. Up next, in a divorce, who gets custody of the health insurance benefits? Do you have health insurance problems? I'm here to solve them, and the solutions may surprise you. It's time for Hey Eric when we return.
I think about it all the time. I have breast cancer, so I have a limited medical assistance card that I can use, and then after that, the bills just keep coming in, so I have no clue what to do. So I'm just lost. I have so many bills just coming in, and they just keep coming.
It's got to be very frightening.
It's frightening. It is, and there's nothing I could do about it.
I needed to have surgery, so I needed to get some sort of health insurance, but it didn't. I think it maybe covered 10% of my surgery, which I realized afterwards. I owe for that, I think, about $8,000. No, 13. It's the bottom of the barrel, cheapest I can get. Covers only doctor's appointments, barely.
My mom just died, and she was 95. She had no medical insurance. She was a seamstress for the longest time, and that was, devastating, financially, emotionally, physically. So I'm 51 now, so I worry. Yeah, I worry.
I provide nursing home care for people who are poor and have always been poor and have had horrible or no health care coverage their whole lives. And so the shape that they come to us in is so extraordinarily compromised that I can assure you I completely understand the difference between people who've had appropriate health care and preventative care their whole lives and people who have had none and what happens to them when they're old. And the government doesn't begin to understand what they're doing about that because the absence of it on one end is costing them a complete fortune on the other end.
Welcome back. It's time for Hey Eric, where we answer your emails and help you slog through the health insurance bureaucracy. Now, here's one that's more common than you think. Unhealthy Marriage writes, my husband and I went through an ugly divorce, and he cut me off of his health insurance plan. What do I do? Well, I'm sorry I couldn't help save your marriage, but I do have good news for you. COBRA coverage and similar state plans called continuing medical plans, or mini COBRA plans, are not just for those who lose their jobs. They also cover people who are legally separated or divorced. You may have to pay your own premium, but unlike employee COBRA plans that run out after 18 months when you lose your job, former spouses get 36 months. So there's no way your ex can leave you high and dry. And get this, if his employer didn't notify you of all this information, your coverage up till that moment is free, and the employer has to pick up the tab. So here's even more great news for Unhealthy Marriage. We went to your ex's employer and got your claims covered retroactively. And because they didn't notify you, they paid your back premiums. And your 36 months of coverage starts now. Our next email comes from SOS, who writes, my daughter has multiple sclerosis. She was recently terminated from my group plan because she turned 20 and is not a full-time student. Now I'm paying $4,012.52 a month for her prescriptions alone. What do I do? Well, SOS, what your insurance carrier and employer didn't tell you is that there are provisions for dependents who are disabled. And with your permission, we talked to your employer and carrier, and your daughter is back on your plan at no additional cost to you. Also, keep an eye on your mailbox. The insurance carrier is sending you a check to reimburse you for those thousands of dollars you spent on medication and treatment. And finally, this email from Fuming Mad in Michigan, who writes, my boss recently found out that I smoke cigarettes at home and threatened to fire me if I don't stop. Can he do that? Well, Fuming, your job won't go up in smoke because you live in one of those states where your boss can't fire you for smoking. However, in many states, and yours, Fuming, you could be next, you can be fired even if you smoke only in your own bedroom. Smokers eventually cost us billions of dollars in medical bills, and the law in many states says an employer can just say no to having you as an employee. Now here's a question for all of you. Let's say you're overweight and your boss sees you enjoying a cheeseburger for lunch one day and says, next time I see you eating a lunch like that, I'm increasing your health insurance contributions. In fact, that next cheeseburger is going to cost you $2,800. Well, guess what, folks? Big Brother has arrived because you can be penalized for everything from the effects of what you eat to not exercising to refusing to meditate. Stay tuned because that's just one thing we'll be tackling next time on The Raymond Report. That's it for this episode of The Raymond Report. I'm Eric Raymond. And remember, don't let those health insurance companies or your employer push you around. Get angry. Let us fight back for you. Email us at heyeric@theraymondreport.com. We're here to help. See you next time.